to the last meeting. Any discussion? Otherwise, all those in favor of approving the minutes of the last meeting signify by saying aye or raising your hand.
Aye.
Aye.
Opposed? Motion carries. Next item is public comments. Anyone from the public wishing to comment at this time?
We have someone joining right now, Clarence. George Bussey.
Oh, okay.
It's in the joining process, so they should be in the meeting shortly.
All right. We'll hold public comments open then in case. And there he is. George, welcome. Good to see you. Are you, we're in the public comments section of our meeting agenda. Anyone have any comments to make? I'll ask one more time, anyone from the public wishing to make any comments? Otherwise, we'll move on to Brighter Futures, Youth Justice Grant updates. Scott?
Hello, can you hear me now? Sorry, I may.
Yep.
Okay, great.
Hey, Scott, Joe Keller here. Let me interrupt by saying that everyone should read the article in which you are featured in that Northland magazine, a very nice article, so good for you.
Oh, thanks very much, Dr. Keller. Appreciate that. Yeah, Northland College did a feature on me in the Spark program for their Northland magazine, so it turned out nice. So thanks everyone. We've got some really good news to share with you all for this meeting. We received 2 grants in the last month and a half. We applied for and received a Youth Justice Innovations grant. That grant is for $100,000 for next year. I believe that we will be able to actually bump that up to $150,000 coming up here this month. They had some extra money left after they had funded all the grants that had applied. And so I think that we're going to be able to receive an additional $50,000 in funding for that. We did do a Youth Justice Innovations grant for 2 years, right at kind of the beginning of my tenure. And we partnered with the Spark program and the Youth Justice Innovations Grant program to provide some pro-social activities for kids that had been referred to the youth justice system. And we were able to work with a number of kids through that program and actually still have kids that were referred to us through the youth justice program that are active participants in the Spark program now. So we definitely did see some level of success with that. One of the challenges, obviously, with a grant that's funded for 1 year, and then we can apply for that grant for an additional 1 year at 50% funding, is that a big expense with this type of programming obviously is staff. And when we are funding a staff member and we have 1 or possibly 2 years of funding, it's difficult to find staff, to find people that are willing to kind of change their path in life to take a position that's only a year or possibly 2 years long. So we've had a little bit of difficulty with consistency in the staffing of the youth justice programs, but we are looking at this year, we're looking at doing something a little bit different. There's a couple different programs around the country that have been having really great success with people who have ended up in the justice system. One is called the Credible Messenger Program, and that is working with people who have been previously involved with the justice system, possibly with folks who have been incarcerated, and working with those folks to get them trained and provide them opportunities to work with youth who are now perhaps just starting to get involved in the youth justice system. And they're called credible messengers. So they are able to have a very different type of relationship and a very different type of conversation with a youth who may be just starting to get in the justice system than someone like me. I, have not been involved with the justice system from that perspective. And so when I tell those kids or have conversations with those kids about the direction of their life, sometimes they can look at me and say, you don't have any idea where I'm coming from. And so finding people who have been in the youth justice system and or in the adult justice system that have started to make those life changes that they need to be on the right path by finding those credible messengers. That's one of the things that we wrote in the grant as something to explore. We did write the grant to be an exploratory grant at this point to really kind of explore some of these other options about ways that we can approach youth in the justice system. The other program that I personally am incredibly inspired by and really excited to dive into a little bit more. For those of you that have heard of Homeboy Industries out in Los Angeles, California, founded by Father Greg Boyle. They're the largest gang rehabilitation organization in the world. And I'm really inspired by the model that they use. They provide wraparound services. They also have started a number of social entrepreneurship endeavors, a bakery, electronics recycling, a screen printing shop, as a way to employ people who are recently incarcerated or who have primarily within that organization, it's people who are gang involved. And so it provides them kind of an off ramp from the gangs. And but a lot of the model that they use, I think, provides a lot of template that we can look at when we start to work with the kids in our community that have not gotten to the point where they're, as Father Greg Boyle would point out, that they have a lethal absence of hope. I don't think our kids are quite there yet here. And I think this is a really great opportunity for us to take a look at some of our kids who are recently involved in the youth justice system and how do we help provide them an off-ramp and show them that there is other opportunities for them. So really excited about the opportunities that we have to kind of explore a couple different models over the next couple of years with the Youth Justice Innovations Grant. And we also did just get word that we have received 3 more years of funding through the Brighter Futures Initiative grant for the Spark program. And that's a fairly significant grant. We did write in our budget for $375,000 for the next 3 years. So while we have not seen the contract yet, I anticipate that we'll be being funded at that full amount for a total of 1.125 million over the next 3 years. That, to be clear, as we wrote that grant, the Spark program is one portion of an evidence-based program called the Iceland Prevention Model. And the Iceland Prevention Model, really to do what Iceland has done over the last 20 years is a much larger endeavor than just running an after-school program for kids. And so I think that we wrote into that grant that we want to pursue that Iceland prevention model with more fidelity. And so that is going to be a heavier lift. It requires a lot more community partnerships, and we'll be looking at a lot of different aspects of what is happening with the youth in our community. And so that's something that we'll be diving into. It becomes a bigger project than just running the Spark program, but the Spark program will continue to be an integral part of that grant for the foreseeable future. So we have 3 more years of funding to secure that program, and we're really excited about that. Within the Spark program, we recently ran a haunted house. We had about 450 people come through the haunted house over the Halloween holiday. We've opened up a new space in the Ashland Area Development Center that we are calling our creative lab. So we have a new creative art space with 3D printers and a lot of art materials and things like that. And then now that we have 3 years, and we know that we have 3 years in front of us, we're exploring some new ideas about some entrepreneurial endeavors to get into with our kids, perhaps opening a skateboard shop in our skate park, some leadership development programs. So we're really excited about the fact that we have 3 more years to dive in and go a little bit deeper with the kids that we're working with. And things are going very well. We had an open house, and we have dozens of new kids who have joined us in the last couple months since we've had that open house. And so the trajectory is looking great. And thanks to Dr. Horning, he came down and visited us and saw us in our space. And I would like to invite all of you at some point, those of you that haven't actually been to the Spark facility, to come down and visit us and see what we're doing.
When's the best time to come, Scott?
Well, I'm there, usually from 9 o'clock until our staff meetings tend to start right on 1:30 each day. So, in the morning between 10 and 1 is a great time. But for those of you that are on the committee and are interested in seeing what we're doing, stopping down between the hours of 3:30 and 6 will give you a better taste of what actually the Spark program looks like, because that's when we have our kids there. And you're welcome. Just bring your mask and come on in and get a chance to see it live and in action. You can hear me talk about it a lot, but until you show up in that space when there's 45 kids doing what they do there every day, it's sometimes a little bit hard to wrap your head around. So.
All right, any questions? Any questions for Scott?
Bravo, Scott, bravo.
Thanks, Laura.
All right, before we move on, I neglected to welcome our new member to this board. Rich Huber is a new member to our board. As many of you know, Joyce Cabasa resigned her seat on the county board after the October meeting, and so Rich has been appointed to fill out the balance of this term on the Health and Human Services Board, as well to replace Joyce. And it gives us representation in the middle of the county. Rich is from Mellon, so we welcome Rich to our board. Next item is the Arpa funding for behavioral health substance abuse.
So I just wanted to discuss, so those of you who are on the full board have already heard kind of what we are planning to do with some of the Arpa funding. The Arpa funding is the American Rescue Plan Act, and Ashland County received about $3 million of that. The board approved kind of putting a placeholder for $1 million for Health and Human Services, because one of the allowable expenses under ARPA are behavioral health and substance use treatment placements and treatment facilities that are evidence-based. And I know some of you who have been on the board for many years have heard how out of control our out-of-home placement costs have been in the past years for youth and adults. In 2020, we spent more than $2 million on out-of-home care placements, of which over 1.1 million were unfunded. So that was county levy that had to be spent. These are court-ordered placements. They aren't optional. We have to provide them. Again, those of you who have been on the board have heard this song and dance several times. So one of the things that the board has approved is allowing us to use some of that ARPA funding to pay for these out-of-home care costs. And what that does is money that we have allocated in our budget for these out-of-home placement costs, we will be using ARPA funding instead of levy, which should then free up levy for other costs throughout the county, or hopefully to replenish the general fund. So to date, we have identified about $359,000 that we are able to use for those expenses, and that's only through July. So we'll be looking again before the end of the year to see what other funding we can switch to ARPA instead of our county funding. That being said, I think that's a good plan. I do want to just caution everybody that the reason the funding is there and available through the American Rescue Plan is because COVID-19 has really been a stressful time for those who have mental illness and who have substance use disorders. And we really are seeing an uptake in people needing services for both of those issues. We have youth who are more aggressive. They're having a really hard time after being kind of isolated during the school year last year, having to do distance learning, some not really doing a whole lot of distance learning, so missing a lot of school, coming back, being integrated again into the social system without all those skills that they had developed before. So we're seeing a lot of referrals for youth justice. A lot of referrals are coming for youth justice because they're peer-to-peer aggressions. In our adult world, we're seeing a lot of people with depression and anxiety and substance use disorders. So although we have plans to, be able to use that funding for $1 million of that ARPA funding, I just kind of want to point out to you that our costs are likely going to increase in that area also. So it's not just, funding that we can shift. It's in the ARPA funding for a reason, and that's because there is a need for those treatments. So just wanted to kind of give an overview of that, how we're planning to spend it, but also a forewarning that not all of it is not going to be used by Health and Human Services, because I anticipate our costs will also go up for that. So any questions on that?
Hearing
Terry,
none? Oh, go ahead,
Oh.
Laura.
Terry, I just like to add as someone who's in the school, yeah, I can attest to the fact that there's a lot of anger, just people with anxiety who either can't get in the school or, the stuff on social media and the trauma. It's having a huge impact on kids and staff and all kinds of families. And so I agree with you that money will probably be spent providing services for those who are really in need, and thank goodness that we have access to that. So thanks for that update.
Any other questions? The next item is 2021 year-to-date expenditures. Pete?
Thank you, Laura Compton. Couldn't figure out how to get to my unmute button. Hi, everybody. This is these are our financials through September of this year. So on a straight run rate, 3/4 of the year, or 75%. What you can see here down here in expenses, the things that we have a fair amount of direct control over, like personnel costs, we're running right where we should be. Same thing with generally our overhead. We have our training and travel this year overall should be lower. We expected it to be, and we're trying to keep it lower. Other direct expenses, those include expenses that we pay to vendors. Those would be including things that Terry was talking about, facilities that for out-of-home placements and for various outpatient treatments and things like that. This tends to run a little bit behind for a couple reasons. The main reason is, one reason is that their billing is always delayed at least 1 month, just because they need to finish a month before they can bill us. And then the other reason is we've got a few that we, a few vendors of ours that we, they, believe it or not, don't invoice us very timely, which seems odd for their cash flow, but we have a few that we struggle with to get their bills from them. This again up here, when you look at revenue, we've talked about this many times, say it again. We're getting to the time of the year where our grants are mostly spent. Our grant money gets spent first before we get to levy. You can see that our we will, I expect by the end of the year, we will be over 100% on our, we'll have more grant money than we expected. That has to do with largely with public health funding related to COVID. It also has to do with, you know, the other managers. I think that Jerry and Laura, adult and children, generally have the most opportunity to do this, but they'll scare up additional funding throughout a given year. And so at the end of it, right now, we're 3/4 through the year. Our funding is 85% of what we expected. So that's good news, I guess, is the short answer. So once again, down here, we're 3/4 of the way through. We've only spent 50% of our levy allocation. However, keep in mind, these last 3 months are going to be much more largely funded by levy dollars. And keep in mind some of these vendor invoices that we wait on. So this looks like there's a whole bunch of money, and it looks like we'll be way under budget. I wouldn't expect that to happen. At the moment, I would expect we will be somewhere near this. Some amount below that, largely because of the public health funding related to COVID. That not only pays for public health staff, it also pays in some instances for some other staff time around the agency when they are, you know, pitching in for COVID things. So let's see. I don't know that a lot of detail through the departments is, there's nothing really that will leap out at us here. This is adult services. I'm expecting them to come in fairly, even though they are 260,000 below their levy budget right now. I expect that by the end of the year, we'll be very close to that, plus or minus something. The ADRC, this, I expect us to be close to this number too, in terms of our levy. Right now, we're 13,000 under relative to the full year. Children and family, again, this is Jerry Esla, these and adult also. This gets back always, the story is always out of home placements. So it kind of depends on how things go from here on out for the rest of the year. And really, like I said, in these cases, we're through September, but for the purposes of talking about those out of home placement costs, those are really on a month lag. So we've got 4 months left of cost really, because September's costs aren't reflected here because we don't get those until into October. The community services programs, the downtown programs at CSP and CCS, they're going to be over their original levy budget. However, that is not due to anything that they're doing. It has to do with It has more to do with how we've changed the accounting for this program. So that is not an operational issue. That's an accounting issue. If anybody has more questions about that, we can definitely talk about that. Economic support, they will be at or under this budget of 120,000 in levy. And I believe to public health should be under budget. Again, you can see up here with the grants, this is what I'm talking about. We had budgeted a total of 124,000 in grants for the full year. We've already received 306,000. We've claimed $306,000 in grant funding. That's virtually all related to COVID. Let's see. What you can see related to that also is some of those expenses are higher. Liz has contracted with contract chasers and so forth. So you can see over 3/4 of the year, we're higher than that on our expenses, but that's only because we have the funding to do that, and that we're using it appropriately. Let's see. So they'll be under their original levy budget. Child support, Kelly Madey, I expect to be right around this levy number. Again, that the revenue for child support is just a little bit squirrely. Kelly and I are still working together to make sure that we understand every last detail about it. So I guess sitting here today, I mean, I would tell you, I would expect us to be at the end of the year at or below this this levy number.
Any questions for Pete? Okay, thanks, Pete. We'll move on to COVID-19 updates and DHS data.
All right, and for our COVID-19 updates, per the CDC, we continue to be in high community transmission levels. DHS does tabulate just slightly different than how the CDC does, so they have us listed as very high. And some of our neighboring counties, for example, Sawyer County is currently considered to be in a critical high level. They've had just crazy case counts coming in the last couple of weeks. So year to date, we have seen 1,974 positive cases of COVID-19. This is a combination of 1,607 confirmed cases and 367 probable cases. Again, this is just essentially the difference in the testing, whether it's a PCR or an antigen test. These numbers, however, are not accounting for the home tests that are completed. Many of the home tests that are completed, people don't actually report them, or when the home tests are reported, the way that we record them rather than a probable or a confirmed case is actually counted as a suspect case. If they have direct correlation with a laboratory confirmed case of COVID-19, we can then consider them as a probable case. But these numbers are lower than the number of cases that we would actually have within the county because of the unreported or unrecorded cases of positive home tests. The state is working on determining a way to accurately capture that number, but they have yet to produce that as far as the programming for recording and pulling information out of the systems for that. We recently did receive an email inquiry. I know it went to quite a few members, whether it be board members or different managers for the different departments, just kind of inquiring as to the accuracy of information that we are reporting. And the information that we report, the numbers are directly either from DHS or from the CDC. And specifically for DHS, about our data and how they measure their activity levels. All of that information is available on the DHS website. And then specifically as to, I know one of the questions in the inquiry was specifically as to how positivity results or positivity rates are calculated. And for that information, they actually take, they are calculated by counting each test, not the person getting tested. So a person is counted each time that they have a test performed. If they have multiple tests, positive or negative, they are counted each time that they are tested on the date the testing lab results is reported. If a person is tested more than once in the same day, only one result is indicated. And as the pandemic moves forward, and it becomes more common for people to be tested multiple times, percent positive by test becomes a more useful metric for measuring the COVID-19 activity in Wisconsin than the percent positive by person. They do go on additionally to say that they have improved the way that daily cases, both cases and deaths are reported to make their data more precise. The method that they are now reporting allows for corrections due to quality assurance to be counted on the date when a case or a death was first reported, rather than affecting the current daily count for cases or deaths. The method that they're now using ensures that the data is clean and quality assurance efforts won't impact the current daily case counts. There's a lot of really lengthy formulas and things like that that go into it. DHS does do a fairly decent job of kind of breaking it down on their website under their frequently asked questions. And then again, in the sections of about the data. DHS does a much better job of breaking it down into more understandable formulas than what CDC does. CDC has a tendency to leave their formulas and information at very high levels. That takes a good deal of time to try and figure out what the heck they're talking about. But the information that we are reporting is accurate. All of our counts and everything like that are drawn right out of the Wisconsin Electronic Disease Surveillance System, which we affectionately call WEDS for short. It's essentially the lab monitoring system that everything is reported into. So those are where our positivity rates and everything are derived from, as far as, you know, accuracy of reporting, because I know that was the question. And then I also unfortunately do have to report that we currently, to date, we have had 19 individuals from Ashland County that have passed away directly related to COVID-19 or complications from COVID-19. 3 of those individuals have just been within, I believe it's been the last 3 weeks that we've lost 3 more individuals. They were of advanced age. However, that makes it no less impactful for their families and community members that have experienced that loss. Otherwise, just kind of general activity. Last week, we saw approximately 40 cases. We've been averaging anywhere from 40 to 50 cases. As of 8 a.m. this morning, we had 25 cases so far this week. So we're looking to be fairly consistent with that approximately 40 case average. We are continuing with our vaccination efforts. Currently, Ashland County is at 63.5% for vaccination. Our lowest percent vaccinated populations are our 16 and 17-year-olds at 48.4%, and then our 18 to 24-year-olds are next at 53.3%. The vaccination rates do go up from there in the age groups, all the way up to our 65 plus population is currently at 95%. We do anticipate that the overall percentage, the 63.5%, will drop slightly once the state makes adjustments for the newly eligible 5 to 11-year-old age group. We are actively working on providing vaccinations for the 5 to 11-year-old age group. We actually had our first in-school vaccination clinic today. We had a couple of nurses out at one of our smaller school districts providing vaccines for children for their parents who had requested vaccination. And we do have more to come. All of the school districts throughout Ashland County have expressed interest in having on-site clinics, whether it be during school hours or after school hours. So we are working around holiday schedules and trying to accommodate those requests as best that we are able. We have actually only one school district right now that, actually two, correction on that, two school districts that have yet to schedule, but we are working on getting them on the calendars. We are also continuing with our walk-in clinic. We did have a walk-in clinic yesterday. It was the largest and busiest walk-in clinic that we have had so far to date. We actually provided just over 130 doses given out of our offices here. So it was quite the busy day for all of us. We had a combination of Pfizer and Moderna vaccine that we were providing, predominantly booster doses, but we did have a couple of people coming in for a first-time series, and also people that were completing the vaccination series as well. And that is about it as far as COVID updates. If anybody has any question on anything COVID related.
This is Matt McKenzie. Just a quick question about the test. It's my understanding that the PCR test is going to be suspended in December. What will that do for turnaround times on people getting tested for their results?
I have not heard that the PCR test is going to be suspended. The Wisconsin State Lab of Hygiene is going to change their testing schedule. They have been running tests up to 7 days a week, and I believe it's on December 4th. They are going to cut back their scheduling slightly. So they'll be running, I think it was Saturdays that they were dropping. So that will be potentially extending the turnaround times. We've been seeing turnaround times, depending on where people are tested at, anywhere from 2 to 5 days. So if somebody is being tested at the end of the week, they might expect a slightly longer turnaround time as far as their test results if their test is going through the Wisconsin State Lab of Hygiene.
Yeah, that was on the CDC website. I guess the concern I have is I'm hearing from, I have several friends and acquaintances that travel back and forth to Canada. And of course, they have to have a test within a certain time frame. And, I'm curious how that will affect it as it starts to get closer to that.
I know with traveling back and forth to Canada, we've had quite a few people that have called inquiring about testing as far as that. And it does get a little bit tricky, specifically, and depending on where you're traveling to into Canada. If you happen to have a prolonged layover in some areas, it can make it very difficult. I don't know the specifics as for the requirements for testing for going into and out of Canada, if it has to be a PCR test or if an antigen test is acceptable. So that would be one other thing to take into consideration, as if they would be able to get an antigen test, which is usually a faster turnaround time than what the PCR would be.
Liz, you mentioned the vaccination at the school today. What was the turnout for that?
The school district that we did today is a very small school district. So don't base your numbers on that. We actually provided vaccinations at OLL today, which is one of the smallest school districts that we have. And they did have, we provided vaccinations to 5 students at the clinic at OLL today. I do know they had numerous other students had already received their vaccinations elsewhere, whether it be at Walgreens or whatever pharmacy they had gone to. So it was a small turnout, but I know that they have had other resources for vaccinations there as well. We are actually planning to be at the Ashland School District at 3 different buildings throughout the course of the day tomorrow, and we are looking at roughly 150 children throughout the Ashland School District for vaccinations.
Any other questions for Liz? Okay, well, Liz, you're up again because we're next on the agenda is Well Women's Program.
Yep.
Mammogram Outreach.
So just rolling into the next then, we have been working with the Wisconsin Well Women Program. They are an excellent resource for different members throughout the community. They are able to provide assistance, often free cervical cancer and breast cancer screenings. And we have had the opportunity to have the mobile mammogram unit take up residence in Ashland County. We're hoping to make it a permanent stop on their schedule because they do travel throughout the region. So we're hoping that this will be a permanent stop and they will actually be setting up in Glidden on April 1st. I've already been in contact with the township and they have been very, very accommodating and have assured me that they will assist with any potential snow removal as it will be April 1st. And we are planning on setting up at the Marion Park by the pavilion as that will accommodate the size of the unit to be in there and then any parking for patients that would be coming through. So we are very, very excited about it and we will hopefully start getting advertising and things like that going out very soon. So very excited.
Okay. We'll move on to unit reports, children and families. Jerry.
Good evening, everybody. It's nice to see you all. I think last month I kind of bragged up that I thought we were going to be fully staffed. However, the night before our worker was to start, she sent Terry a message and let her know that she had received another offer from another entity and was going to be taking that job instead for, I believe it was like $3 more an hour. So we continue to be short-staffed, and that position is unfortunately one of our busiest positions, and that's in initial assessments for CPS investigation. I did some running of numbers this morning. We are sitting right now at 226 Child Protective Services reports year to date, and 54 youth justice referrals so far year to date. And just to touch on a comment that Laura Cruz had made, we too are seeing that a lot of these circumstances are people with heightened anxiety, a lot of anger. The youth justice referrals that we're seeing from the school particularly are those that just seem bizarre. The kids are at each other and just fights are breaking out just over little things, whether that's social media or he said, she said kinds of things and with kids just barging into classrooms and going after people. It's the referrals that we're seeing on the youth justice side, although are lower than our numbers are lower than in years past. We're seeing much more reactive kind of severe incidents that are going on. Another thing for you guys, really kind of a fun thing. We are participating with MMC and the Lions Club again this year to distribute Christmas presents to families that we work with. So between the MMC units that have contacted us and the Lions Club, we will be providing Christmas gifts for 24 families in our county, including 63 children newborn to 17 years of age. And then our other update for this month was that our unit got to take a little field trip over to the courthouse, which was kind of fun. And we went into the county boardroom and spread out all over the place and had a training with Assistant District Attorney Ruth Kressel. Ruth has done this training for us quite a few years back. And it's really a helpful training for us in terms of all of the legal actions that we would take in terms of child protective services cases, from doing temporary physical custody requests at the front end of cases to petitioning the court and all of those steps going forward. What's really helpful about the training that we get from Ruth is we all have our basic intake worker training, so we know the statutes that are involved with these types of cases, but we don't know necessarily the kinds of details that the district attorney's office is going to be looking for in filing these petitions, and what it is that they have to be able to prove to make these things get through court. So Ruth actually takes the time and walks us through all the jury instructions that shows us all of the elements of, this is what I need to prove for neglect. This is what I need to prove for physical abuse. This is what I need to prove for sexual abuse. And that way we are able to get that information to her earlier on in these cases and really try to streamline things. It was really interesting to see the reaction of the newer workers and kind of the aha moments that were going on. Oh, that's why she asked for that, or that's why she asked for this. So again, thank you to Ruth Kressel. She is such a great benefit to our unit. And we love the fact that she takes the time to come to our staffings and go through our cases, and then provided this wonderful training for my unit. So that's what I have.
All right, thanks, Jerry. Any questions for Jerry? All right, next is Adult Services. Laura.
Good evening. So I just wanted to update everyone. We had applied for an additional grant for the ADRC and did get the award letter. We are getting an additional $20,000 to go towards continued COVID outreach efforts. And so a lot of the funding goes to marketing, which we don't typically have. So for those of you that are in Ashland, we currently have an ADRC billboard on Highway 13 as you come into town. So we're going to be able to continue that, and then looking at getting some radio ads out, which we've never had for the ADRC. So we're really excited about that. And then we were made aware of additional funding we're getting for the dementia care specialist position. Since that position started, we've had one worker for 5 counties. And so they have been spread extremely thin across the region. And we will be hiring at the start of 2022 an additional 1.5 individuals in that position. So instead of one person covering 5 counties, we will have a full-time worker covering Ashland and Bayfield. That's Ellie Webb. She's our current dementia care specialist serving all 5. She is going to stay on with Ashland and Bayfield. And we are in the hiring process for a dementia care specialist to serve Price and Iron County. And then we'll be hiring a half-time dementia care specialist in Sawyer. So that not only opens up the amount of families that they can work with individually, but we also are going to work on working with different businesses and making dementia-friendly communities. As many of you are aware, our population continues to age. And so just trying to get as much information out there and to be able to provide as much programming to our residents as possible.
You mentioned radio ads, Laura. Does the consortium pay for those ads that have been running on TV?
The ADRC ads?
Yeah.
Yes. Yep. That comes out of our dementia care specialist funding, out of our marketing bracket.
Every time I see those, I been meaning to ask and I keep forgetting.
Yep.
Any other questions?
Say, Laura, this is Matt Horning. Maybe this is a bad question. The aging unit senior center building, I guess, doesn't require masks. Is that some sort of oversight, or it looks like it's the county over that unit and not this board, but trying to figure out why they would have a sign that says on the door, masks not required.
So they are separate from us and have their own board for the aging unit. They're a not-for-profit. And so although we work together with them, we don't have direct oversight.
Doesn't the county board though have oversight? I guess it maybe.
No, the county contributes some money to them, but they have their own separate board.
Dr. Horning, just so you're aware, we did at one point have discussion about trying to, take over some of the aging unit, but they're a private nonprofit, and really they determined that they do a really good job, and they do it much cheaper and more efficiently than we could. So there was some discussion back when, but they are separate from us.
But don't
Any
some
other
of our staff work at that building, or is that false?
The elder benefits specialist is our employee, and we have a memorandum of understanding with them for the billing piece. Some of the funding has to go directly to the aging unit. And so although she has spent time and is housed over there, that was more because of when we were doing the remodel, they agreed to have her over there. And also she was going back and forth, and it was just easier for her people to access her over there. But so she's our employee. Gets a little complicated. She's our employee, but she is housed over there. And then we have an MOU for that funding piece.
Perfect. Thank you. Yeah, that was my sense. A community member came up to me, said, how could this be? And I said, and I had to look, it looks like the county board appoints that board. So it's, there's certainly some county board role in this, but yeah, probably not for this board to do anything about. So thank you. Sorry to take up people's time.
County board has a representative on that board, as far as I remember, but
their website says the county board appoints their board members. That's just the aging unit
maybe we
website.
approve them, yeah. I think maybe we approve those board members, right? And one of them is a county board representative, but. Any other questions for Laura? Next is economic support.
Good evening.
Oh, there you are.
I'm Melanie Connors. I'm the economic support supervisor. And I'm just going to give a little brief update on our WEAP program, the Wisconsin Home Energy Assistance Program. And so far this year, our calendar year starts October 1st and goes to May. So for WEAP, so far we've had 482 applicants. Of those applicants, we have actually serviced 417. And they received a total of $260,364 in benefits towards their heat or electric bill. We've actually assisted 5 households in crisis mode, so meaning they were either out of fuel or being possibly disconnected from their service, and that totaled $4,284. And then we also refer people for furnace activities. So we had 7 repairs, and those repairs totaled $1,883 so far. And then we had 3 total replacements, and those replacements totaled $27,401 this year. And so we are probably on par about right now to continue to meet our goal. We usually hit between 800 and 880 applicants per year. So with our 482, we continue to be like right on stride when it comes to our application processing. Any questions?
This is Matt McKenzie. I guess the question I have is on the furnace replacements. Are those done on properties that the people requesting the funds are the owners of the property, or are they also done on rental properties?
We actually have to get verification of ownership. So it is for people who own their properties.
This is Laura Negro. Is this typical for this time of year?
Typical as far as numbers that process over? Yes, by usually the end of November, we've processed about 500 applications. There is a new process right now with the state. They've actually instilled an online application process. The county is not processing, meaning my worker is not processing those online applications. The Energy Services Inc. is processing the online applications. It has given us a little, I don't know what do you want to say, a headache at times, because as you know, in our department, we do food sharing Medicaid. If another agency is actually working on those cases, we could pull that application in and finish that for the customer when they're in our offices or give us a phone call. We cannot do that with the WEAP application. So that's kind of a catch 22 on that. So it's a little snag there, but yeah, we are about on par.
Is that step in the middle hurting the end users or citizens by creating problems in there, or is it not to that level yet?
Meaning the online application with Energy Services at times is causing an issue. I have seen situations, and Neil Deering from, we work with him very closely with the furnace program. And he has actually experienced where, because the application is delayed from Energy Services Inc., the people who are no heat situations they cannot be referred to the furnace program. So it gets a little bit difficult because, again, it's not like we can just pull that information, that application into our agency and take care of that customer information. We have to rely on that agency and try to assist them to get that application completed.
Thank you.
Anyone else with a question for Melanie? Then we'll move on to child support. Warrant issues.
Good evening.
Kelly?
Hi, everybody. Sorry if I'm a little dark. My kids broke the light throwing a football down here, and we have not gotten around to fixing it yet. So I got every light on, but it's not enough. I can see that. Anyway, I just wanted to talk a little bit about some issues that our office is having with warrants, and we have been attempting to work with our jail, and Lieutenant Kim Lavasser has been working with us, but it's become an issue, and it's not enough. Our program is ran on funding that we get for our performance, and although we are taking strides to lean in a less enforcement direction, we are an enforcement agency, and unfortunately, how we get payers or non-custodial parents to pay child support at times requires a warrant for their arrest and requires them to be arrested. And it is quite amazing when they do get picked up, how fast they come up with that $500 or $1,000 or whatever it is. But since COVID has started, which we're now going on 2 years, at first we couldn't put out any warrants at all, and we canceled all the ones we did have. And we thought things were getting better. The judge was issuing warrants, the family court commissioner was issuing warrants, business was back as usual. And then we started getting phone calls from upset parents saying, so-and-so got picked up last night and he got pulled over, and I'm saying it's she too, he or she got pulled over, and the police let him go. And then I'll call the police station and say, you seriously let this person go? Like, we've been looking for them for 2 years. And the city PD will tell me, Kelly, we called the jail, they wouldn't take them. I don't know what else you want us to do. I'm like, okay. So we started pinpointing that it was an issue with our jail. We were getting work lists sent to us from other, counties saying, Joe Blow is incarcerated in Vilas County Jail. I see you have a warrant out for her. Do you just an FYI? So we'll call the jail, we'll call Vilas County Jail and say, how long are they going to be in on your warrant? Have they talked about ours at all? And they'll say, well, we called Ashland, but they told us they're not putting a hold on them because they're not taking them. So like, there's no contact, there's no anything being done. And this is happening a lot. Probation and parole just emailed us yesterday. They just lost the third person since COVID started that has been a probation agent, because I'm sure there's other reasons, but the probation agents I have talked to, they can't do their job. The jail's not taking people. They say it's because of COVID. I've reached out to, we have a county or a statewide web email that we send stuff out to see, throw ideas around with other counties. And, I threw that out there. Are any other counties struggling with this, or am I the only one? I did have 17 different child support directors respond. And the only one that is having issues is Milwaukee County. Well, they're not even remotely close to our size. Otherwise, everyone is back to business as usual. And surprisingly, a lot of them are doing COVID testing right at the jail when they bring people in. So this is something that is an issue, and I'm just kind of hoping to bring some awareness to it, and not trying to throw anybody under the bus or make fault or anything like that, but it is definitely a county-wide issue. And I feel a safety issue and an issue for families. When no money's coming in to the parents that need it, it is a problem. And when we can't do our job, it's a problem. When we depend on that to do it. So our warrants that we put out have kind of started to become a joke to the people that they're put out for. And we've seen it flaunted on social media, got picked up, nobody's arresting, got away again, so it is something that I feel needs to be addressed at some point in the future here for our county. That's all I got. If anyone has any questions, I'm happy to answer them.
I don't have any questions for you. I do have a little bit of insight, but I will try to help with this since the sheriff's department does come under my PPLE. I know we were having issues with probation and parole holds that were in the jail that were taking up space that we couldn't get to prisons because they're not taking anyone. So I know that was one of the issues we were dealing with. And I know we were full, and we were actually out. We had farmed out at least, it was 2, 3, 4, something like that. But I'll make some contact too and see if we can try to work on this.
I appreciate that, Laura. I really do.
It's what we're here for, is to all cooperate.
This is Matt McKenzie. I see Dan Grady's on our call too. So I would think he should be able to help you and Kim work this out. It sounds like it's an internal issue more than an external one.
Yeah, I can give Kim a call tomorrow.
And I honestly haven't talked to Dan, just because when Clark was here and we had issues with any kind of like the jail or any kind of elected official, we were always told that the county administrator they're elected and he can't do anything. He never would, address it or talk about it or anything. So I did not bring this to Dan. He probably has no idea that this is happening.
Yes, that's correct. But I will give Kim a call tomorrow.
Thank you, Dan.
Right. Good, thanks. Any other questions for Kelly? Otherwise, sorry, Val, I skipped over you. Val, community service programs.
Well, this is actually pretty good, because the one after me is talking about staffing issues, and I got staffing issues. So we'll go through the other stuff here first, and then Terry can tell you more about my woes. So we continue to get lots and lots of referrals. We've had 17 referrals since October 1st. 9 folks have been admitted. We're still working on 8 to process those referrals and get them in as soon as possible. Oftentimes we do get referrals in, like if we get referrals from the inpatient behavioral health unit, they come with everything we need per state statutes to do that intake. We sometimes get them in within that day or within 24 hours. We try to get them into the program before they're discharged from the hospital. So when they're discharged with the support they need to be successful in the community. The biggest issue where we've had is if I would have talked to you a month ago, I would have told you we have all the contracted vendors we need. But then of course, almost overnight, we lost several of our contracted providers. And then right now we have 6 full-time service facilitators. 2 of those are open positions. So we've got 4 people not only doing the job of 6 people, but they're also picking up the services. We're triaging folks and picking up the services that normally we will contract out. It's not good. It's not good. And we work with people who are suicidal. We work with people who are in quarantine. We work with people who have COVID. And the people we're working with, as you've heard here already, there's just increased anxiety. There's increased substance use that is, in my opinion, directly related to increased mental health because of the ongoing pandemic. The other thing we're doing right now, we're in the middle of administrating the state satisfaction survey, which we're required to do each year. And I do bring that to you. I believe I should have that all wrapped up in time for the next meeting, but that does drive our quality improvement. So you can look forward to that. So I'll let Terry talk about some of the issues we're having with staffing.
If there aren't any questions for Val, then we will talk about staffing issues. Terry? Looks like you're muted.
Sorry about that. So unfortunately, I have a lot of staffing changes to update you on again at this meeting. So I'll start with those. In the children's unit, we had Christine Randall, who was the initial assessment worker. So Jerry had referenced, they're the ones who go out and investigate child abuse complaints. She had resigned, which resulted in an internal candidate accepting that position from the CCS service facilitator position. And as Jerry indicated, she took another job the day before she was to start the IA position. A much higher paying job. I think it was about $3 an hour more. So we thought we had that position filled, and I blame it on Jerry because he jinxed himself by bragging that he was fully staffed. But that being said, it is what it is. We did then have some shifting again within the unit. We did hire Brittany Kopp, who is hired to be the family specialist worker in the children's unit. So she comes to us with good experience. We also lost Laura Martinson, who resigned as the coordinated service team and children's long-term support case manager. She left to go for another higher paying position. We then had Tia Smith move from the CCS service facilitator to fill that position. That's in Laura Compton's unit. We then we're still actively recruiting for the open CCS service facilitator positions, and we did hire a great new worker, Miranda Provost. So we were lucky to fill that position, but that still leaves us, as Val indicated, with 2 open service facilitator positions that we're actively recruiting for. And then on top of that, our long-term employee, who is a mental health professional for the CCS position, Liz Callio, has given her resignation also. Her last day will be in December. She got a very huge sign-on bonus where she is going and a higher wage. So we also had one retirement, Ken Zurian, who I think you knew this was a planned thing, so you knew he was going to retire. It was planned that Rebecca Nielsen would be promoted internally to take his position, and she did do that. However, she also has found a different position in a different state, so she will be leaving us shortly. So that position is open. We were able to fill Rebecca's position that she left with Pam Fustel, who I believe joined us on this call today. So welcome, Pam. She comes to us with a lot of experience, and we're very lucky to have her. We have some open positions. One of the resounding themes from every meeting that we've had this year is CCS service facilitator position. So I just want to talk a little bit more about that. The CCS service facilitator position up until now has been a bachelor's level required. So it needed to be a social worker or a related field, human services field, and a bachelor's level. We pay a very different scale for the CCS service facilitator. We start them out, the highest wage is $19.32 an hour. And that goes back to when we were in a scramble to take on the New Horizons, when they had given us 30 days notice and we needed to keep the CCS service, the whole program alive. So we were able to hire the staff internally. We did it within 30 days. We hired them at the scale they were at. And unfortunately, that has never been relooked at. I know I petitioned people to try to encourage the county board to do a wage adjustment for them. I am aware that we're past the budgeting stage now, but I just want to make you all aware of how this is affecting us in more ways than just one. These again are bachelor's level social service people who, when there are positions in other parts of our agency, specifically the adult unit and the children's unit, they can, if they're qualified and a good fit, they can transition into those open positions, get a 4-day work week and a higher wage. And the requirements education-wise are the same. So you can see right there why we have this revolving door and this open position for the CCS service facilitator. We unfortunately, there is and I know you're all aware of this, and we've been singing the same song for months now, but there is a worker shortage, and it is extremely difficult to hire in all kinds of areas, but especially in the mental health and social worker positions. They're very difficult jobs. Some of our positions are working with severely mentally ill, parents who are using substances, our clients who are using substances. It's very difficult for people in these helping fields emotionally, and so it's hard to recruit anyway. Given the fact that we pay much less than our surrounding counties and private entities, that's part of our retainment issue. I honestly don't know where all the new social workers go when they graduate. We've been reaching out to colleges. We've been trying lots of different initiatives, trying to find new people. Val has done a great job of providing internships and trying to grab people before they come out that door so that they know that we have worker positions open in their field and don't have to leave our community. So I guess those efforts are ongoing. We haven't given up, but we have had to lower our educational requirements to try to get some workers in that position for CCS service facilitators. So we are now accepting applications from associate's degree people, and we've had some good fits. But they, again, because it wouldn't be fair for somebody with a bachelor's level who's gone and paid for 4 years of schooling to be paid the same as an associate. So they're starting out in an even lower salary. So I don't see that as a really sustainable path for us, because if we start you out at $17.50 an hour and put you in a position where you are working with suicidal people, you are working with mentally ill, you are working with people on drugs, who may have some erratic emotions at times and can be a little scary sometimes, depending on where they're at in their illness. And we're going to pay you $17.50, but you could go to work at McDonald's or Quick Trip for $15 an hour. So I know that's more of the fiscal piece that I'm bringing to your attention. I know we have a wage study that is going to happen in 2021. It unfortunately doesn't mean we're going to have more money to give people. For the CCS program, this is my pitch to you, and I know we're past the budgeting process, but if the opportunity comes to bring the CCS service facilitators with bachelor's level degrees up to a $22 an hour wage, which would be competitive with the adult unit and the children's unit, for 9 workers, the total of which for those 9 workers would be $54,000 in increases, would only cost the county at the most $3,216. So it may not even cost that much, because CCS, we're still working on making it fully funded. It is supposed to be fully funded, cost-based. We're working with the state to make sure that we can capture all of our expenses as we're supposed to. So to me, it's just common sense that for $3,200, you can give a substantial raise to 9 workers. I mean, I'm sure we're paying that much for the training and the advertisements and the recruitments and okay, so that's the fiscal piece. I'm going to let Val kind of talk more about how it impacts our participants.
So again, of those 4 full-time service facilitators we have who are doing the work of 6, 2 of them have less than 3 months experience. So the 2 long-term service facilitators are now trying to train in these 2 new folks, in addition to covering the work of 6 service facilitators. And so that really stretches them thin, and we are not able to provide the quality program that this program needs to be. And I've been talking about it. I don't want to go there yet, but we are at the point where we're not going to be able to sustain this program. I'm going to have to put a cap on people coming in. And in this time frame right now, when we're hearing from the school district, we're hearing from BHU, North Lakes, and all over, and we're experiencing the level of challenges the folks we're serving are having right now. This is not the time frame for $3,000 to be putting our services, our direct services, to the people who most need it in our communities at risk. And again, a good share of the folks we work with are suicidal, they're homeless, they are mentally ill, some of them are using substances. And when you've got a stressed out workforce, that's just, it's not good. It's not good. Right now, everybody's holding it together, but how long can we do this?
So if you have any questions, let us know. If there's any way we can resolve this before the next fiscal year. I don't, like Val said, I don't know how long we can sustain it with the workforce that we're at and the wages that we're paying, but that's the situation. I just thought you should be aware of it. And let me know if you have any questions or ideas.
Well,
When Terry and Val mentioned that to me last week about the fact that we could raise those 9 workers' pay a total of $54,000, only cost the county $3,000. I thought, that just makes good sense to do that if there's some way we can do that.
but this is Laura Cruz, and so how can this be done? Because my concern is, so we have these maxed out people. We've got people who are just learning the job, which is very intense, and the wages are low. What happens when those people are like, I'm out of here? I'd call this a state of emergency. I really would. And so I don't know what the process is, or if you need a motion that this board would like to take it up to the county level and support the increase in wages because of the nature of, I mean, really, this is under a COVID situation, which just makes it all the more challenging and difficult. And so I'm more than happy to put a motion if that's what we need. I just don't know what we need, but I'm willing to do it. Been there, done that, and it's gonna cost more in human terms. Just something has to be done.
I don't know, Dan, do you have any input on that? Like I mentioned before, there is ARPA funding. I don't know if we could use that as part of this. It's something, we might be able to explore. But again, I don't know if we can do it outside of the budgeting process. Maybe we could if it is ARPA funding. What do you think, Dan?
I don't think ARPA funding can be used for it. Why don't we talk after Thanksgiving about the state reimbursements and stuff and see how we can see what the numbers look like.
Okay.
Do we need a motion to help encourage that?
I think just maybe a board recommendation that we look farther into this. I don't know that we really need a motion, but just board recommend to Terry that she and Dan get together and look into this further and see what the possibilities are.
Okay.
Yeah, this is Matt McKenzie. Unfortunately, it also isn't listed correctly on the agenda to do any action on it other than what you already suggested. It sounds like the people that should be aware of it are talking about it, and that should continue. Unfortunately, we finished our budget process here earlier this month. So puts us kind of in a bad spot here.
Let's keep this on the agenda, and see if there's some way we can resolve it.
Okay.
Thank you.
All right, we'll move on to written materials and anything we need to be aware of in that.
Just one thing, and I'm not sure if I know it was sent to you, but there is information on the WCSA, which is the Wisconsin County Human Services Association, WCSA. Their fall conference, even though it's held in December, they call it the fall conference. And it is virtual this year, and they are opening it up to any county employees, including the board members who may want to participate. We only have to pay for one registration, and then anybody that is interested can join in. You don't have to attend the whole conference. You can attend parts that may interest you. I have a little bit more time. I think the registration is due next week. If you are interested, I know I've heard from one board member already that they are interested, and so I will add their name to it. If you are interested in attending, I think they are asking for it when I register. So let me know if you're interested and I'll add your name in. And then you, I think we'll get a separate Zoom link so that you can join in, and it might be interesting for you. So you are welcome to attend, just let me know.
All right. Move on to board member updates and agenda items. I do have one update that I will mention. Our 7th granddaughter was born this morning. That's
Nice.
7 granddaughters.
Congratulations.
0 grandsons yet. We do have a step granddaughter, a step grandson, and a step great grandson, but no grandsons. And Liz, you'll be interested to know it's Matt's daughter.
Congratulations, Matt.
Aw, Matt, congratulations. Congratulations, Grandpa.
Any other updates or other business? Otherwise, our next meeting date is February 16th at 4:15. And we've completed the agenda. So if anyone would care to make a motion to adjourn.
Laura Cruz. I'll second. Laura Cruz.
Motion made and seconded to adjourn. All in favor?
Aye.
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 Opposed?
Aye.
I'm sure that was voting to adjourn, not opposed. So motion carries. Meeting is adjourned. Thanks, everyone.
Thank
Thanks,
you.
Clarence. Good job.
Good night, everybody.
Clarence,
Thanks,
tell Matt I
Jerry.
say congratulations.
I will.